Today I'm going to tell you about my favorite element for your health, about my favorite essential mineral, without which I can't imagine my life, the lives of my patients, or basically anyone on the planet. It's magnesium. Magnesium deficiency is seen in 80% of the population because food is depleted of magnesium, there's no magnesium in water, none in the soil, and the daily consumption of magnesium is very, very high. A stressful situation, even minimal stress, we didn't get enough sleep, didn't rest well, goodbye, magnesium. A workout, excessive sweating, goodbye, magnesium. Sitting in the office, not enough fresh air, goodbye, magnesium. A glass of your favorite wine, goodbye, magnesium. Your favorite candy, goodbye, magnesium. As a result, we're in a terrible magnesium deficiency. While magnesium is a crucial element, a cofactor, a catalyst for over 300 enzymes in our body, participating in almost all metabolic reactions in our system. Besides everything else, magnesium is found in a complex with ATP. ATP is adenosine triphosphate, and all our body's systems are energy dependent. They depend on ATP. That includes the brain, the liver, muscle tissue, and the cardiovascular system. They are all absolutely magnesium dependent. Magnesium normalizes the function of the heart muscle. It affects the metabolism of phosphorus and calcium in bone tissue. It reduces the formation of oxalate stones in the kidneys and bladder. It also prevents, which isn't obvious, the toxic effects of lead and regulates blood glucose. Magnesium is desperately needed for people suffering from insulin resistance, type 1 or type 2 diabetes, or just being overweight in general, and not necessarily obese, just overweight. Magnesium lowers blood pressure. Magnesium is a natural calcium channel blocker. As a former cardiologist, I know what I'm talking about. It really enhances, and sometimes even replaces, antihypertensive drugs, which are the medications people take for high blood pressure. Plus, magnesium also affects blood vessels as a natural organic beta blocker. Magnesium relaxes blood vessels and lowers blood pressure. And by the way, a very common complaint from people with low blood pressure who take magnesium is dizziness. So if you have low blood pressure, if you're hypotensive, then magnesium should be taken before bed, or the dose should be split into several intakes. You don't take a large dose all at once, like 400, 500, or 600 milligrams. Don't do that. Your pressure will drop, you'll feel nauseous, dizzy, and you'll feel unwell. It's best to take magnesium before bed. Again, here we're looking at the goal. If the goal is relaxation, deep sleep, anti-stress, and calming the nervous system, it's better to do it before bed. If there are other goals, you can move it to the morning, but it's safer, again, if you have low blood pressure, to do it in the evening. If you have high blood pressure and take antihypertensives, you can combine them, by the way, with magnesium. They'll enhance each other's effects. Magnesium is a powerful natural antiarrhythmic. Arrhythmia is accompanied by magnesium and potassium deficiency in 90% of cases. When magnesium is low, as we all know, potassium is flushed from the body. Magnesium normalizes the excitability of cardiomyocytes. Those are the little cells in our heart muscle. In addition to everything else, it has a cardioprotective effect. Cardiologists often administer it, especially in the ER. They give magnesium intravenously. Magnesium sulfate cannot be used orally because it will trigger severe diarrhea. Magnesium is not absorbed in the form of sulfate. Keep that in mind. Magnesium sulfate is only for intravenous use. Magnesium is a natural organic, let's say, blood thinner. It affects platelet aggregation and prevents blood clots from forming. I can compare it here to aspirin to acetylsalicylic acid. In other words, magnesium is an organic aspirin. Besides, magnesium is an antiplatelet agent as it is a calcium antagonist. And we can say that taking magnesium is a great prevention, a preventive measure for stroke. I also have to say, magnesium is the best organic statin. It greatly affects cholesterol metabolism. It really is a natural organic statin. If you are magnesium deficient, there is a very high risk of atherosclerosis. Low-density lipoproteins increase, that is, bad cholesterol, blood sugar and glucose increase, and with magnesium deficiency, statins work less effectively. So if you have high cholesterol and you take statins and they don't seem to work well, don't rush to increase the statin dose. Add magnesium to your statins and you will see an enhanced effect. I should say that although I'm a former cardiologist, I worked for many years in cardiology and cardiac intensive care, and I also prescribed statins because we were required to by certain regulations. But I want to say now, after 15 years of my practice with patients, working with patients, that statins are prescribed only as a last resort when the patient's risks are very high. Very often we can lower cholesterol, triglycerides, and low-density lipoproteins without prescribing statins by eliminating deficiencies, by adjusting the diet, and by normalizing fat, lipid, and carbohydrate metabolism. Magnesium is essential for creating DNA. Magnesium is the basis of chlorophyll. Chlorophyll is found in dark green vegetables, and magnesium is necessary for protein synthesis, which in turn affects many processes in the body, including tissue growth and repair. That's why I always recommend everyone drink a green smoothie in the morning. Magnesium is absorbed in our intestines, in the duodenum, which is why gut health is so important. And that's why my green smoothie is for the intestines, the duodenum of the small intestine, the gallbladder, and for overall magnesium levels. Magnesium prevents skin aging and protects us from hyperpigmentation. Among other things, it affects skin elasticity. Magnesium deficiency contributes to the development of skin hyperpigmentation by disrupting the molecular mechanisms that control melanocytes. These are skin cells, and magnesium has 4 levels of impact on the skin. Consequently, its deficiency leads to a deterioration in the mechanical properties of hyaluronan strands and the drying out of the connective tissue base, collagen, which means early aging. Magnesium is a strong sedative and analgesic. It reduces headaches and, in principle, any pain by inhibiting the excessive passage of nerve impulses from the brain to peripheral nerves and muscles, suppressing pain sensations. My patients, myself, my friends, absolutely everyone around me takes my magnesium because it's a very powerful sleep aid. It promotes the production of melatonin and serotonin. And indeed, magnesium plunges you into such a good deep sleep, where you wake up rested and feel energetic and fresh in the morning. That's why I always recommend taking magnesium with vitamin B6 in the correct form. I'll definitely tell you about the forms now as well. Disruption of circadian rhythms, our sleep rhythms, due to anxiety, hyperactivity, lack of sleep, shift work, working at night, or jet lag can very often lead to hormonal imbalances. And to help magnesium work properly, to maintain healthy circadian rhythms, it's very important to practice sleep hygiene, follow a sleep schedule, avoid bright light from gadgets before bed, and maintain regular physical activity. Magnesium is a natural anticarcinogen, especially when combined with vitamin B6. And magnesium can be used both during oncology and during recovery after cancer treatment. On a large scale, magnesium intake can affect T lymphocyte function and significantly support immunotherapy for cancer treatment. If you're currently undergoing cancer treatment, consult your doctor about magnesium because generally, you need to be very careful with nutraceuticals in oncology. Well, magnesium is one of the few that isn't just not contraindicated, it's actually recommended. What symptoms of magnesium deficiency might you notice in yourself? It's of course apathy, depressive states, a lack of normal sleep, anxiety, panic attacks, hot flashes, PMS, constipation, diarrhea. By the way, both constipation and diarrhea. Restless leg syndrome, memory loss, headaches, hair loss, biliary dyskinesia, bile stasis, frequent colds, eye twitching, which is a very common symptom. In pregnant women, it can be increased uterine tone or calf muscle cramps. And for pregnant women, by the way, magnesium is absolutely essential. It also works best with vitamin B6. Because if the mother has a magnesium deficiency, the fetus will likely have skeletal defects, vision problems, and the mother could face a risk of miscarriage, placental insufficiency, lower back pain from magnesium deficiency, gestosis, swelling, cramps, and even gestational diabetes. So it's recommended, of course, to consult with your OB/GYN, but generally the dose. Magnesium is taken until about 36 weeks, at least 400 milligrams with vitamin B6. During breastfeeding, this dosage increases. And in children, of course, magnesium deficiency can manifest as scoliosis, kyphosis, stretch marks, and so on. How do you choose the right form of magnesium and not get confused at the pharmacy? It really is a bit confusing, and the choice of magnesium form depends on various factors. For example, for gallbladder issues or gallstones, magnesium orotate or magnesium citrate would be suitable. To boost energy levels and for recovery, quick recovery after workouts, for instance, magnesium malate. For sleep and relaxation, to get deep sleep and rest at night so the body can recover, magnesium glycinate will help. To normalize the nervous system during high anxiety or panic attacks, magnesium taurate. For the brain, for memory, to improve focus and concentration, magnesium threonate. A universal option for everyone, absolutely everyone, is magnesium chelate also known as magnesium bisglycinate. Some people may tolerate certain forms of magnesium better than others due to their individual characteristics or health status. It's all individual, of course, but generally, keep this cheat sheet I just gave you in mind when you go to buy magnesium at the pharmacy or online.